this is really the bread and butter of what we were talking about in terms of training, and really what we emphasize with a lot of that pre-prosthetic training and even post-prosthesis training as well. And so here, the main things I want to show you today, point out today, is the virtual arm, which is this practice button right here in the middle. And you're going to see, depending if you chose a right or a left, this is what's going to come up. And this is a wonderful playground for the individual to use as they're learning their prosthesis. All right, so it will hopefully respond as you calibrated it. This is a chance to give you that feedback where it says open when you want it to open, it's closing when you want it to close, it's bending when you want it to bend. It's, again, just a nice feature to see and train as an individual is getting better and more proficient even before they get their final prosthesis. All right, so again, it's a very nice tool that I spend a lot of time, at least in my therapy sessions with individuals, on this screen pre-prosthetically, because it does give them a sense of what to expect and that feedback that's hard to understand if you don't have the prosthesis in front of you. And in terms of our games here, these levels at the bottom, the beauty of the levels is, again, they're meant to be for individuals to maybe take the system home. As an OT myself, I definitely can relate to giving patients exercises and then them either not doing them or doing them the wrong way. So we actually are able to track with the history feature if they were to complete these different games and if they were able to improve their score. And we've actually even seen some clinicians use that tracking and that history page for the games to actually file for appeals and to further get more reimbursement. So we find that to be a very helpful tool as well, so that you not only can see your user get better, they can see themselves get better, but you can also use that perhaps if you needed to appeal or kind of work with an insurance company, it might be giving you some more challenges. In terms of the levels, we have levels 1 to 6. They are not necessarily sequential where you have to go through all of them. How they're organized is levels 1 and 2 is just meant for 1 degree of freedom. Okay, so it's just maybe you're only working with a task and you're only doing different grip patterns and open. And so levels 1 and 2 are only going to focus on those different things there. We'll open up level 1, and you'll kind of see here that basically it's going to give you a cue card, and that cue card is then going to just tell you what to do. So think of it like flashcards, where I want you to complete this grip, I want you to open, I want you to close. As the user is then doing it, you'll see that green bar going around the edge of the screen. That is what's going to help, give the visual feedback that it is taking and it is working, and then it will give them a star rating at the end, just for some other feedback as well, as so they can kind of start to track their performance. So level 1, as you see, is just kind of, here's the cue, here's the motion, I want you to complete it. Level 2, which I'll show you just in now, is actually going to be more about graded motion. And this is important because that's what prostheses are all about. We don't always want to open all the way or close all the way. We're usually hoping to use the device functionally. So it's giving you that little target. So in this example, your kind of the fingers going to that little dot, and that's kind of how you're going to track their progress there and to kind of work on that grading of movement, which again is preparing that individual for the use of their prosthesis. All right. Levels 3 and 4, what those are going to be are just now have 2 degrees of freedom. All right, so maybe you have a wrist rotator and a multi-articulating hand. So it's starting to teach the individual how to send those different patterns. There's no technology right now out there that allows concurrent movement, bending and opening at the same time. So this is where we're teaching the user that you do have to think in terms of sequence, where you have to send your pattern for wrist pronation before you send your pattern for open, and that there needs to be a rest in between. So again, level 3 is similar to that level 1, where it's just giving you the cue cards to complete them. Level 4 is going to be similar to that level 2, where you're then actually just grading your task and kind of hitting a target. So all of this, again, is just meant to help an individual learn to not only perfect their patterns, but to start to think of them in terms of functional use and actually incorporating that into their day-to-day as well. And then levels 5 and 6 are just going to be similar, but they add another degree of freedom. So that is one that has an elbow component, a wrist component, and a hand component. And so similar to levels 1 and 3, 5 is going to be that, here's a cue card, just complete it, and level 6 is going to be that target. All right, so as you see me doing these levels right now, at the end, you'll notice it's going to give you some feedback page that'll kind of allow you to take a look at the results a little bit more, but also it's going to help give the user some feedback as to what patterns we're most confused by. All right, so it's going to tell you what was this device maybe most confusing your pronation with, your supination with, just to help kind of prompt that user to manually to think a little bit more critically about separating those different types of patterns. Maybe they look too close at this time. And so that's just another helpful feature that we have here that we might signal the therapist, the clinician, or the user to go back to that main signals page and do some more work there. Okay. So I know that was a very quick run through, and definitely if you were to ever purchase one of these systems, we're going to go through all of this again in detail. We always want you to be successful if you're using it, but I did want to give you that opportunity just to see the Myotrain in action and to see kind of how this page works.